I say this to literally everybody because everybody needs a mouth guard. Nobody wears a mouth guard, but do you wear a mouth guard?
I'm actually getting one very soon. Yes.
Yes. Thank you. Yes. So I pretty much just work my way, and I'll take some notes during, literally head to toe. Just going through really thoroughly. Everything looks nice and healthy. Your hair is really nice and thick. Close your eyes for me because I'm going to be coming over the face and eyes. Shrug against me. There you go. Keep them up. Good.
Yes. 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 Soft.
Good.
Sharp. Sharp. Seven, eight, 12.
Then the pulses. As an ASMR artist, I take my sleep very seriously. And where else would an ASMR artist sleep but on the best mattress available? And that's why I sleep on a Helix mattress. I answered a few questions about my favorite sleeping positions. I'm a side sleeper, as well as the firmness preference that I usually sleep with. I kind of picked in the middle, sort of hard, sort of soft, because Jeremy and I have slightly different preferences there, so it seemed like a good in-between. And I was recommended the Helix Midnight Luxe mattress, and I got it in a queen size bed. There are so many things to love about this mattress, but I'll list a few of my favorites. First and foremost is this ultra soft mattress topper. It is so bouncy and soft. It feels like one of those luxury hotel mattresses that I always sleep like a baby in. I've slept on this for a couple of weeks now, and I have to say my sleep has definitely improved. First of all, I just like being in bed. It's comfortable, and it's also been nice waking up in the morning, not feeling any of that low back pain that I was starting to feel. Helix is also just a great company to work with. They have the Happy Helix guarantee, which gives you 120 days to decide if you like your mattress. I'm not the only one who says this, by the way. They have won tons of awards, including USA Today, where Helix was ranked #1 amongst 23,000 mattress brands in 2026. I highly recommend taking their mattress sleep quiz to see what type of Helix mattress might be right for you to help improve your sleep and overall well-being. You can click the QR code for more information or visit the link in my description. Thank you so much to Helix for sponsoring today's video and for sponsoring every night of my sleep. Now relax and enjoy. Hi, Michelle.
Hi.
Dr. B. Nice to meet you. Thanks for coming in today.
Thank you.
We're going to be doing a full assessment on you, just kind of everything logged in the books and seeing anything that might come up. I do know that I have a couple of notes from your previous physician, so we will definitely focus on certain areas. But in general, I want to get a good sense of you as a patient, so we'll go from there, okay?
Thank you.
So I pretty much just work my way, and I'll take some notes during, literally head to toe. Sometimes I jump around. You know, I'm kind of living on the edge here. Okay. Well, let me know if you have any questions. Is it okay if I place my hands on you during the exam?
Yes, that sounds good.
Okay. So we'll start with the head, and we'll work right down, and I will be placing my hands in the hair. Is that all right?
Okay, yeah.
Okay, I'm just going to sanitize them so I don't get anything yucky on you. I did just wash them, so we should be all right.
No worries.
And I've got lovely hair, and I'm just going to be looking through the scalp. Just checking for any signs of bumps. Have you had any head injuries in the past 10 years?
I have. About a year ago, I bumped the back of my head.
Okay.
On the right side.
Not this side right here?
Yeah.
Okay, I'll check that. And was that a diagnosed concussion?
No, it was not.
Okay. Did you lose consciousness at all?
No.
Okay, just had a nasty little bump.
Exactly.
Okay, I'll take a look. Any residual headaches from that?
No, luckily.
Okay. What about headaches in general? Are you prone to them?
No.
Excellent. Just going through really thoroughly. Everything looks nice and healthy. Your hair is really nice and thick. Try not to mess it up too much. Good. Okay. And so it was right back here?
Yes, that's exactly where it was.
Okay. Any tenderness there still?
A little.
Okay. Go nice and gentle. So I do actually feel something there. A little bit of swelling still. And you said that was a year ago?
Yeah.
Okay. So it can take a long time for sure, but we'll definitely do a little extra neurological testing just to make sure there was nothing going on from that. Is any of this irritating or painful as I'm touching through the scalp?
No.
Okay. While I'm over on this side, I'm going to do a little bit of light palpation, so you're going to feel me press. And again, if you have any pain, please let me know.
Okay.
And I'll be pretty gentle on the back there, but I do want to assess it. Okay. Any tenderness here?
No.
Excellent. Check the other side. Looks like you have some good growth too. You've got some cute little baby hairs up front. That's excellent. That shows us that it's maintaining its growth pattern. Fresh hair coming in. A little bit of color in your hair.
Mm-hmm.
Is that something you do consistently?
Yeah, maybe twice, 2 times or 3 times a year.
Okay. I'm seeing just the smallest bit of breakage.
Mm-hmm.
Is that something you noticed as well?
I have. It may be due to my thyroid issues and low iron.
Okay. When was the last time you had your blood work done?
It's been a few months now, actually. I should probably do that soon.
Are you taking iron supplements as well?
Yes.
Okay, good. That should work pretty quickly. If it's not, if you're still low, even though you're taking it kind of consistently, then that's something we want to look into. Okay, so same thing on the side, just kind of light pushing on the scalp. This side feels good. No strange bumps on this side. Just the regular ones. The brain bumps. Okay, I'm going to slip my hand up the back here and just feel a tension in these occipital muscles, and yours are super duper tight. Does that feel tight to you?
It
Tender?
does.
Yeah.
Yes.
Okay. And you're a desk worker?
Yes, I am.
Okay. We'll do a little bit more muscle checks later. But I want to take a quick light. So close your eyes for me because I'm going to be coming over the face and eyes. And you've got some freckles, which are absolutely adorable, but we're wearing sunscreen every day.
I could be better about that.
Okay, definitely make sure to be wearing sunscreen every day. Maybe get a moisturizer sunscreen. So you're doing both at once. Hopefully we're not too sunny here, but you're still getting the UV rays. And do these freckles get more pronounced in the summer?
Yes.
Okay. I can't say I'm not jealous, but also you want to be careful since you are prone to them. But they're so cute. So looking at the texture of the face, super consistent in color and texture. Pores are nice and small. Skin is not too taut, not sagging. Perfect. Healthy consistency. Okay, looking at the eyebrows, and those are even. Can you make a couple of faces for me? So you can raise your eyebrows nice and high, all the way. There you go. Okay, and now close your eyes really, really tight. Perfect. You puff your cheeks out, and then don't let me push them. Good. And stick your tongue out and move it side to side. All right, excellent. That's good. No drooping or anything like that. Can you push against me? I'm going to test the strength of the neck. Exactly like push your head forward.
Okay.
Yep. And now push back into me. And does that cause any pain?
No.
Okay. And push down against me, chin down. Very good. And to the right side and to the left side. Okay. And does that cause any pain in the neck?
No.
Okay. Now I know you don't have a fibroid. That was removed.
Correct.
Do you ever experience swelling in the lymph nodes at all?
No, I have in the past, but I'm not recently.
Okay. Is it like when you get sick or just kind of randomly?
Yes, typically when I get sick.
Okay, that's fine. That's normal. Just checking all the lymphatic chains. When was the last time you had a cold or flu or something like that?
It's been a while. Probably about 8 months.
Okay, that's good. It's kind of like once a year type of thing.
Yeah.
Okay. You shrug your shoulders for me. Shrug against me.
Okay.
Like up like this.
Okay.
There you go. Keep them up. Good. Relax. All right. So I think that's all fine. I will have you. I'm not gonna bother having you swallow for me, honestly, because you don't have a thyroid, so there'd be nothing to look at. But I will look at the pulse in the neck.
Okay.
And then, are you getting any fatigue with not having the thyroid?
Yes, actually quite a bit. If I don't get several hours of sleep, I'm pretty tired in the morning.
Okay. Was that worse after you got it removed, or is that something you experienced before?
It's worse after I got it removed.
Okay. Just gonna make a note of that. All right. Now, fun stuff. I'm gonna have you follow my little light. Do you wear any glasses or contacts?
I do wear glasses normally, yes.
Okay. You're not wearing them now?
No, I
Okay.
usually wear them at work on the computer.
Okay, but you're okay, like, just to see this
Yes.
here. You can see that without any
Yes.
double vision?
Mm-hmm.
Okay, follow it everywhere it goes, just with your eyes, please. Does that feel painful, or you feel any double vision or straining in the eye?
No.
Okay, I want you to follow it all the way out, and now all the way in. Good, and that was all okay. Okay, I
Yes.
want you to close your eyes, and when you open them, I want you to find the light.
Okay.
Okay, open. Good. Now close them again and find the light. Good. One more time. Close and find the light. Very good. And one last time. I lied. Open. Find the light. Very good. Okay. So that's good. Nice movement of the eyes. Looking at the pupil size. And it's about a 3 to 4, which is great for the light in the room. Okay. Now just relax the best you can. Just kind of gaze off into the distance. You're going to see a bright light come into view. All right. Very good. Okay, now close your eyes. I'm going to look over the lids. And do you see kind of like that brightness behind the lids?
Yes.
Okay. All right. Open your mouth just a little bit as long as I've got my light out here. I'm going to take a look at your sinuses. Those look nice and clear. Thank you. You're a fast learner. Okay. Any pain here?
No.
Here?
No.
Here?
No.
Great. All right, so now I gotta look in the back of your eye. Got a couple of fun things here. Okay, Jen, just look straight ahead.
Okay.
You're not too veiny in the eye. Not a bad thing. But do you get dry eyes ever?
Sometimes, yes.
Okay, yeah, sometimes when there's a little less blood flow, it can be an issue, but if it's not, usually drops will help that.
Okay.
So very nice, kind of a little lighter on the eyes, like light hazel, would you say?
Yes.
Yeah, so just got to be aware of, sunscreen, but also sunglasses.
Okay.
So a very small chance, but still a chance of melanoma in the eye.
That's good to know.
I have light eyes as well, so something I look out for too. Okay, now give you a book. I'm gonna ask you to do some work. So hold that for me.
Okay.
And I'm gonna come around here and just have you read that number for me.
That's a 7.
Okay. Page.
16. 12.
All right.
8.
Next. There we go.
26.
Okay. And the last thing is going to be a little puzzle. So you see how there's 2 X's here?
Yes.
So I want you to take your finger, start on one of the X's, and make your way to the second X using the colored line. Very good. Perfect. Okay. Now with these little fun shades on, I'm going to hold them here.
Okay.
I want you to look through them, and I want you to tell me what number I'm holding up.
2.
Okay, and what about now?
5.
Okay, now I want you to cover one eye,
Okay.
and I'm going to do the same thing. I'm going to hold up a number, and in fact, I'll kind of just swing it here so you can look at me. And just kind of stare at my nose and tell me how many fingers I'm holding up total.
4.
All right, and one more time.
4? No, 3.
It's okay. Go ahead and close your eyes.
Okay.
Let yourself normalize. And then open and look straight at my nose and tell me what you see.
2.
Perfect. And try the other eye.
Okay.
Kind of blink it back. There you go. How many fingers am I holding up looking at my nose?
2.
Okay, and this time,
3.
try that one more time. Right in your peripheral.
4.
There you go. Okay. And I want you to keep that finger there. I'm going to do the same thing, and I want you to tell me when you see my fingers wiggling by only staring at me, okay?
Okay. Now.
Mm-hmm.
No. No.
Okay, speed there.
No. No. No.
Okay, now switch eyes.
Okay. No. No. Now. Now. No.
Okay. I would say few of those peripheral tests are definitely a little bit like less than we'd like to see as far as like overall vision goes, but everything else is fine. So if you feel like you can see, just keep an eye on it. If you feel like the peripheral vision is getting worse, where you're like not catching things out of the corner of your eye, then you can address it then. But I'd say you're still like on the lower end of normal.
Okay, thank you.
Great, okay. So now, I think that's fine on your eyes. Just look, turn you forward again.
Sure.
And I'm gonna just keep this open. There you go, looking for the blink reflex. Very good. And while I have this, we'll test a little sensation. Okay. So you'll feel a little puff of air, okay? With your eyes closed, just say yes when you feel it. Okay. And I will be trying to trick you, so it's not gonna just be on the sound, it's really the feeling.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay, now I'm going to do that same sensation, but I want you to take your pointer finger, either one, and just point to where you feel it, okay? Good. Okay. Now we're going to do a slightly lighter sensation. Tiny little fresh puff here. And compare that to a bit of a sharper sensation. So I'll show you on your chest what that's going to feel like. So that is quite sharp, you feel that? And then that is quite soft. But I'm going to be doing the same motion, either soft or sharp, or dull or sharp, whichever you prefer. And I want you to close your eyes and tell me what you feel.
Okay. Soft. Soft. Sharp. Soft. Soft. Soft.
Good.
Sharp. 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 Soft. Sharp. Soft. Sharp. Sharp. Soft.
Okay. And does this feel the same all the way down?
Yes.
Same sensation?
Yes.
Same sensation?
Yes. Yes.
Okay. And this, the same as this?
Yes.
I just want to check that little spot in the back of your head. I'm just going to turn you so I can get a better look at it. It's a fun little rotating chair we've got. And does that feel sharp all the way down?
It does, yes.
Okay. And can you feel this little puffy sensation?
A little, yes.
How about here?
Yes, I can feel it pretty lightly.
And how about here?
Yes.
Okay, that's fine. So come back around to the front. And we'll revisit these a little later when we go check out your arms. For now, I think that's fine. Take a look at your nose. Okay. And you haven't been sick. Do you have any issues with your smell?
No.
Okay, I'm just going to tilt you back gently. Okay, right side slightly more occluded than left. Can you cover one nostril and breathe in? And then relax. And then cover the other nostril and breathe in. Oh, interesting.
I have been told I have a deviated septum.
Yeah, okay. I did definitely notice that because the occluded side actually wasn't even what I thought. But interesting. But you're not having any like trouble breathing or anything like that? Are you waking up at night feeling out of breath?
Yes, and I do tend to grind my teeth quite a bit at night.
Okay, we'll definitely take a look at the jaw. All right, so I'm going to test your smell. So cover the bad nostril up first so you have the good one presenting. Yeah, and take a nice big smell of that. Does it smell familiar at all?
It kind of smells a little like lavender or eucalyptus.
It's jasmine, but same family. So we'll do now the other nose.
Okay.
Other nostril, I should say. You should just have the one nose. Okay, and
Yes, that does smell like kind of like a minty eucalyptus smell. Maybe they're
it's
blending into
it's peppermint.
It's peppermint.
Yeah.
That one was definitely harder to smell
Okay,
through.
let me give you one more on that side. So same thing, cover the one you just had covered.
Okay.
Yep, and try that.
That is a very fresh scent. I can't place it. Lemony.
Yep, lemon. Okay, so I mean, you definitely can perceive, but you know, with the deviated septum, you literally have like cartilage blocking some of your your receptors into your brain, right? Because the nose leads up all the way into the old noggin there.
Yep.
So you will have some, probably a little bit of like discomfort with your smell. Again, if it gets worse, then, you know, they possibly can go and they can break the nose and reset the septum, but it's about comfort.
Okay.
I don't think you're at risk of like, is your taste okay?
Yes.
So I don't think you're at risk of like losing any senses. It's just that you literally have some blockages on the one side.
Okay.
It happens. Okay. And then I want you to open your mouth and say, "Ah," for me. Okay, very good. And you were saying your jaw did some grinding, right? Okay,
Yes, quite a bit.
behind you and feel the jaw. Oh yeah, those masseter muscles are angry. Is that tender?
Not necessarily tender, but it's tense.
Yeah, tense. You can feel it.
Yes.
Yeah, so feel how tight this is right here. Okay, and can you open and close for me? Open and close one more time. Okay, no clicking, but it did feel pretty stiff. And then this muscle right here, you feel how it's like jumping.
Yes.
Yeah, so it's really, really tight. Clench your teeth for me. Okay. And then your clench is not, like your muscle up here is not actually that strong or defined. Some people's are like popping out when they have, it feels like it really is just like in this lower jaw. But you said you grind, right?
Yes.
Okay. So yeah, so it's less that it's like the jaw, the TMJ is like popping and clicking, and more that these are just really sore from you like moving them back and forth.
Yes.
I say this to literally everybody because everybody needs a mouth guard. Nobody wears a mouth guard, but do you wear a mouth guard?
I'm actually getting one very soon. Yes.
Yes. Thank you. Yes, that's amazing. So that's happening actively.
Yes.
Okay. So we can check in and see how that's going. Especially if you're doing it while you're sleeping, so important to wear a mouth guard. Okay, open the jaw just a little bit. I'm just going to test a reflex. Very good. Now the arm reflexes. Try to relax for me. Oh, this is so soft. A little bit. There you go. You try to fight me, but you can't. I'm gonna get you. Thank you. And how's the shoulder feeling when I do this?
Feels okay.
Okay. There you go. All right. So the reflexes are good, nice and reactive on both sides. A little hyper-reactive, I'd say, at some points, like kind of jumpy, but
It's like anticipating it. Maybe.
yeah, maybe so. I think that's comes from also sometimes when your muscles are quite tight and you suddenly relax them, they're like they're so ready to go. They're like, let's do it. As long as it was consistent side to side, which it was, that's all we really look for.
Okay.
Okay, and so now I'm going to feel some of the muscles in the joints in the body. And I want you to just stop me if anything feels really tender.
Okay.
And I'll make the movements. So let me have the weight of your arm. A little clicking in wrist. Is that normal?
Yes.
Okay. And while I'm here, I'm going to press on the nails. And I have to say, I love when people have their nails done because it's quite pretty, but it is actually easier to assess you when you don't. Okay, very good. Internal, external rotation. Okay, I'll check the other side. Not so clicky on this side.
Yeah, this is my work mouse hand, I think.
Are you right-handed as well?
Yes.
Okay. Okay. Just to do some carpal tunnel tests because you're a desk worker and because you're showing some signs of crepitus on that right side. So if you want to look at me, just follow my movements. Hold like this, push, push, push. Is there pain in the shoulders or the wrists?
No.
Okay, I'm going to tap here. Any tingling or numbness?
No.
Okay, flip it around like this. Push, push, push. Same thing, any tingling or numbness there?
No, it's a little tender that
A little tender?
Yes.
Go ahead and relax and point to where that was painful for you.
Here.
In here. So it feels more like a stretch?
Yes.
Okay. What I'm more concerned about is actually underneath here. The carpal tunnel nerve runs along the wrist. And when it gets really, really bad, they have to just do surgery where they cut you open and fix it up. So it doesn't, you're not displaying any signs of carpal tunnel. So put your nails up against each other like this.
This.
Yes, and then the next one. This, checking for clubbing, which you don't have any. Excellent. And then, do you get cold hands and feet in the winter?
Yes.
Okay, so we'll test a little bit. Your cap refill was good. We'll test a little bit where I hold here, and I want you to pump your hand. And I am cutting off your circulation on purpose.
Okay.
And now open and relax. And nice color return. Same thing, open, pump, and relax. Good. So no issues with that. You ready to fight me?
Yes,
Do
I'm
some
ready.
strength testing. Okay. Push against me.
Okay.
Pull.
Okay.
Hands like this. Keep me, yep. And then push me away with your fingers. Out like this. Don't let me close them. Yeah, this one's definitely hurting a little more. Up like this.
Okay.
And keep them up. And pull me down. There you go. And what did I miss? Can you go back like this?
With both arms?
Just one. Okay. I just want to see. And then the other side. Any pain with that in the shoulder?
Over here a little bit.
That was worse on that side?
Yeah.
Okay. Did it hurt in the front of the shoulder or the back?
Kind of just sort of like it's a little tender here.
Okay. Okay. I'll just make a note of it. Relax. So left shoulder with external rotation. Just keep an eye on it. I actually don't feel any major swelling, but if you tweaked it, or it could just be that you need to like stretch out and open up the
That makes sense.
the back a little bit. All right. A few more tests while I have you up here. I'm going to take your temperature.
Okay.
And just do a couple vital signs.
Okay.
Get the palms. Should be warmer. Yep, they are. Okay. And now the pulses. So I'm just going to do one at a time up here. looks like the nurse took your blood pressure before I came in, so. Okay, 118/82. A smidge high, but not really. Keep an eye on that too. But have you ever had any like high blood pressure issues?
No.
Okay. I mean, they say 120/80, so you were 118/82. So like,
Okay.
you know, technically within normal range, but okay, just relax. Okay, I'm gonna take a couple of deep breaths on the front and out. In and out. And just relax now. I'm just going to listen to the heart. Just lift this arm up for me gently. Thank you. Okay, pulse is good. A little low, actually. Okay. I'm going to retake your blood pressure. Because another source of fatigue could be low blood pressure. Help me out there and hold on to that. Just a second. Put this here. Okay, thank you. And just set your arms down. Good, your legs are uncrossed. Just keep your arm there. Okay. One more time. Yeah, no, I'm getting it to be a little low, actually.
Okay.
It just came in at 105/72. Might have you, do you have a blood pressure cuff at home?
No.
Okay, might get you one.
Okay.
Have you just track it for a little bit.
Okay.
Just because if you're having some low blood pressure, do you ever like get dizzy or lightheaded when you stand up?
Sometimes,
okay.
Yes. Mm-hmm.
There's something called POTS, but you don't have a lot of other symptoms of it, like hyperflexibility and things like that. But yeah, we just want to make sure.
Okay.
If the blood pressure is a little low too, that could be directly related to the blood work. So we'll have you get that done again and recheck your iron.
Okay.
All right. Swinging around for the last time, last bit of a movement till we go put you on the table, and I'm going to check your back. So first feeling the spine. Can you bend over like you're going to dive into a pool? Thank you. And just come up nice and slow. Good, nice straight spine. Feeling the muscles either side. Okay, I'm going to tap. And I'm listening, but you don't have to do anything. No, breathe just normally. Okay, so I'm hearing nice hollow taps when I'm going over the ribs, the lungs. That's what we want because it's a nice inflated little balloon. And then dull when we get down to the kidneys. Good. Any pain with that?
No.
How about here?
No.
No? Okay. I'm going to listen now to the lungs. This will involve you taking another 4 deep breaths every time I touch you, okay?
Okay.
Out. In. Out. In. Out. Did you feel lightheaded there at all?
No.
Okay. When my hands touch the body, I want you to say 99.
99. 99. 99.
Okay. You can come back around, and you're done with the physical tasks. We're going to do a couple of mental tasks before we lay down.
Okay.
So I'll have you repeat after me if you can. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. And can you say A, B, C, X, Y, Z?
A, B, C, X, Y, Z.
Okay. And you could hear all that clearly from me?
Yes.
Okay. Close your eyes. Tell me if you hear a sound on the left, the right, or both sides.
Left. Right. Right.
Mm-hmm.
Left. Both. Right. Left.
Good. Keeping your eyes closed, I'm going to whisper something and I want you to repeat after me.
Okay.
1, 2, 5.
1, 2, 5.
Okay. This side. 7, 8, 12.
7, 8, 12.
Okay. And you're not really having any issues with your hearing, are you?
Not that I know of, no.
Okay. Put your arms out.
Okay.
And keep them there.
Okay.
Now close your eyes and flip them over. Now touch your nose with this finger. Touch your nose with this finger. Okay, relax. I'm going to pull this up.
Okay.
And you can pull the other one up too, if you don't mind.
Mm-hmm.
And we're going to try the same sharp or dull test on the arms. Feel
Okay.
that there?
Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp.
Okay. Remember when I had you point to where you felt this air? I
Mhm.
want you to do the same thing, okay?
Okay.
Okay, very good. I'm going to move your finger in a couple different directions. So this is down, this is up. Well, actually, let's do the whole hand from the wrist because your fingers are a little sensitive. Up like this, down, right, left.
Okay.
Okay. Tell me which way I'm going.
Right. Right. Left. Down.
Sorry, I cracked you there. Same thing.
Left. Left. Right. Up. Down. Right. Down.
Okay. Now keeping with our fun little tests.
Mm.
I'm going to write a number in your hand. I want you to tell me what number this is, okay?
Okay.
I'll try to...
8. 8.
Yeah. I drew that very weird the first time. That's not on you, that's on me. Okay, and this side. Is it again? It's facing you.
2.
Yep, okay. And what is 8 and 2 when you add them together?
10.
Okay. And if you were to find a crying baby on the street, what would you do?
I would pick it up and call the police.
Perfect. Testing your logic, thinking,
Okay.
things like that. just want to know what you personally would do with the baby. Yeah. I'm like, there's one right there. No, you're all set. Okay, so we'll have you lay down on the table now.
Okay.
We'll finish with just your lower extremities. So we'll test the strength and the sensation in your lower legs, and then you'll be good to go.
Okay. Great.
Okay, so we'll take a look at the tone of the legs first, especially the knees. Do you have any knee issues?
Some inflammation on them.
Okay.
specifically on what knee?
I was gonna say, I was literally just about to say it's not your right knee because feel how much more swollen that is there than compared to this. Like I can really feel the kneecap on the left side, and then here it's just all swelling. Okay, we'll test that. Just relax. So if I knock this here, is that going to hurt you in the knee?
No.
Okay. Again, you give me all your weight. Very good. I'm stronger than I look. Saying that I'm having a little harder time getting reflex on the left side. This is going to tickle. Very good. Very good. You were able to know what was coming for the second side, huh? That's all fine. Push up against me.
Okay.
This is testing the hip muscle. Okay, relax. Other side. Okay, a little more strength on the right side. Left side's a little bit weaker. I'd say 4 out of 5, 5 out of 5. If you're more right-sided, that could just be that you use, like if you jump off your right foot, but pull me toward you. Push me away. Very good. Same thing on this side. Just gonna pull me towards you. Push me away. Was that painful in these?
No.
Okay. Push down.
Okay.
Push down. Pull back. Pull back. Very good. That's all fine. Nice and strong. I'm gonna pull you out here. I'm just gonna. Any pain in the hip?
No.
Okay. Hip okay.
Seems okay, yes.
Yeah, okay. Good. Yeah, definitely is swollen here. I'm going to hit this tuning fork. It's going to have a slight vibration. You should be able to feel it even through the pants, but I want to know if it feels stronger on one side or the other.
Okay.
So that's that. You feel it?
Yes.
And then that's that.
About the same.
About the same. That's good. And what about on this ankle bone? You feel that there?
Yes. About the same.
About the same. Very good. And then on the hip?
I don't feel it on the hip.
Okay. This side?
I feel it on that side, though.
Okay.
I still don't feel it on that side.
Okay, that's fine. Does this feel cold?
Yes.
Same cold here?
Yes.
Okay. And then, you feel that through the pants, the sharp
Yes.
versus the dull?
They feel a bit the same.
Okay, what if I went like this
that's sharp,
versus
yeah.
this?
Yep.
Okay.
That's dull.
Let me know what you feel.
Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp.
Okay, that's perfect. Now I want you to take this foot, this heel, and run it down this knee, all the way down there. Okay, and same thing on the other side. Very good. That is totally fine. Grabbing my light. And the skin down here is not nearly as freckly. So is that mostly on your face?
Yes.
Okay, check the arms. Really look at these before. No, those are nice and clear. Okay. And then the pulses. very last thing is I just want to listen to sound, hear if there's any bowel sounds. So if you don't mind moving your hands slightly, I just want to hear those gurgles. Oh, very nice gurgles.
Mm-hmm.
Any issues with your stomach?
I do gurgle a lot, quite a bit. Mm-hmm.
Yeah, your gurgles are good. No, that's good. That means you're processing food. I mean, do you have a special diet? You eat like gluten-free, dairy-free, anything like that?
Typically vegetarian.
Vegetarian, okay. But you're feeling enough, or getting enough like legumes and things like that, or do you eat mostly like pasta and...
I try not to eat as many carbs, so a lot of salads.
Salads are good, so a lot of vegetables, fruits, things like that. Okay, yeah, because that could also, again, we'll get your blood work done, but if you're having, you know, kind of not enough proteins in your diet, that can definitely lead to energy levels. So things that are like carbohydrates, even things like fruit, even if they're healthy carbohydrates, you're going to get this burst of energy, and then you're just going to be like, oh, I'm so tired. So, but I mean, how long have you been eating vegetarian?
A year.
Okay, so it's pretty new as well. So, but that's not, when did you get the thyroid done?
That was several years ago.
Okay, so the fatigue happened pre-vegetarianism.
Yes.
Okay, so probably not the culprit, honestly, but good to keep in mind.
Okay.
All right, well, I think you're doing pretty well. We're going to get the blood work done. We'll kind of see what that says. And I want to keep an eye on some of the joint issues. So I want to know how you're doing after your mouth guard has been in for a little bit, see if that's helping with your jaw tension at all. And I want to keep an eye on the right knee because it is fairly swollen right now.
Okay.
If that continues, we can, I mean, you should try some at-home stuff, and I'll print stuff out like some ice and stretching, but we can try PT as well to try and reduce some of that swelling if that continues, okay?
Okay.
Any questions for me?
No.
All right, well, thank you so much. This has been great working with you, and I'll see you in about a year unless something unusual comes back with the blood work.
Okay, sounds good.
Thank you.
Thank you.